Africa Director. Thank you very much for joining us here on Bottomline Africa. She's joining us via Zoom. Now, there's this third AstraZeneca dose coming at a time where there are shortages in vaccines, not even forgetting the fact that there are people who haven't even gotten their second dose. How necessary is the third?
So I think at the moment what is happening is the evidence is building to give us answers to questions we might have in the future. So you're absolutely right. At the moment, the registration here in Kenya and also what the WHO is saying about the AstraZeneca vaccine is the need to have 2 doses. The data recently published by the University of Oxford looking at a 3rd dose or a booster dose is merely there to guide us in the future in case, for instance, there are additional variants that develop, and if booster doses will give us the added benefit that we might need to protect us against additional variants. So it's in a way, it's data that provides an answer to a potential what-if scenario. What if in the future we get additional variants? Would we need a booster dose? And the good thing is that we now have the answer to that, that if we need booster doses, that we do know that the data supports that and that it gives the necessary protection if there are new variants that do emerge.
There's so many questions surrounding the COVID-19 pandemic in general, the virus, but also the new variant, that is the Indian variant. What is the efficacy levels when it comes to these vaccines and the Indian variant?
So here I can give Kenyans who have tuned in today, I think, a real sense of comfort. Very recently, Public Health England published a real-world evidence paper. This is patients who have received, people who have received the AstraZeneca vaccine, 2 doses of the vaccine in the UK. And what they looked at was the efficacy and the protection that the AstraZeneca vaccine gave against the Delta variant. And what we know is that there is a 92% protection against severe disease and hospitalization. So once again, if people have had the original AstraZeneca vaccine, the one that is currently also being rolled out here in Kenya, it gives them a 92% protection against developing severe disease and hospitalization in case they do contract the Delta variant.
Due to the shortage in the vaccines, there have been talks of mix and matching vaccines from different brands. For example, AstraZeneca, Johnson & Johnson. What exactly are the implications of this?
So I think the first thing is we continue to work very closely with the regulatory body here in Kenya to ensure that they have all the necessary information to make an informed decision in terms of what they deem is the right way for the vaccines to be used for Kenyans. So what we do know is there was recently a study published that looked at the AstraZeneca vaccine and the Pfizer vaccine and all the different combinations and permutations of how those 2 vaccines can be used. And the bottom line of that study is that it showed that whether you had 2 doses of one vaccine or whether you had 1 dose of the one vaccine and then the other dose of the other vaccine, basically it provides very, very good and strong protection.
All right. So, for example, for the sake of our viewers, if I have had both doses, that is the first and the second of AstraZeneca vaccine, if I take the Johnson & Johnson dose or shot, then that's fine?
So at the moment, there isn't data looking at that combination with Johnson & Johnson. The data that the University of Oxford have published is looking at AstraZeneca and Pfizer. So at the moment, we do not know about the mixing and matching, for instance, of a vaccine such as the Johnson & Johnson vaccine. At the moment, what we also need to remember is the WHO is still very clear in the guidance to say if you've received the first dose of AstraZeneca, you should receive the second dose of AstraZeneca as well. But obviously, as the data is emerging, the WHO, as well as the regulators in countries such as Kenya, will then look at the data and make the right informed decision what is best for Kenyan people.
All right, since there has been a shortage in these vaccines, how best can we build our capacity when it comes to producing our own vaccines, especially in Africa?
So I think the first thing to say is that the AstraZeneca vaccine has by far the widest reach. Around 170 countries globally have got the AstraZeneca vaccine. And through COVAX, 38 countries have also received the AstraZeneca vaccine. And we have seen a shortage in recent weeks, and currently the situation in Africa is really critical. And this has really been driven by the fact that we've seen this devastating second wave in India. And because of that, the Indian government made the decision to ban all exports, and this has caused this delay in vaccines from India flowing into Africa. What we have seen is there's been a real step change in the last couple of weeks through donations, either donations that were pledged during the G7 summit, as well as the Japan summit that was held in June. And we've already seen that around 18 countries in sub-Saharan Africa have benefited from vaccines. And why I'm sharing this is because at the moment, for where we are in the pandemic, speed is really of the essence to get the vaccines to countries. So one of the things that AstraZeneca have done is we made the decision that in terms of how we've set up our supply of the vaccine into countries, and especially also here in Africa, is we have a twofold approach. The first is that our vaccine is brought in at a no profit price. And then the second thing that we have done is that we are working with several partners globally. These are established vaccine producers, where we then do a full technology transfer. Basically, we're sharing all of our intellectual property with them, and they then produce on our behalf. It allows us to ensure global supply standards, the good quality of the vaccine. So whether it's a vaccine that you get from the Serum Institute of India, from the UK, from Latin America, it is the same quality. So that's really been our approach in terms of how we are setting up supply into Africa.
Okay, as we conclude, I want us to talk about the EU Green Pass, which has been causing quite some discussion. Oxford, AstraZeneca, Pfizer, Moderna, Johnson & Johnson are on the list when it comes to the European Medicines Agency. But then we have Covishield and Covaxin, which are not. Why is that?
So what we have seen in the last couple of weeks is around 18 countries in Europe have now added Covishield to the list. And once again, whether it's a vaccine, an AstraZeneca vaccine made in India, in the UK, in Latin America, we know that the quality and how the vaccine works is exactly the same. We continue to work as AstraZeneca with all of our partners, together with the EMA, so the European Medicine. This is the group that basically approves and has the final say in terms of the regulatory approval of, for instance, the vaccine. We continue to work with them to ensure that Covishield will be added, and we are actually expecting a final answer around that, if not in the next week, then definitely in the next 2 weeks.